Hi everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Now, today's topics we're gonna talk about the side effect of antidepressant. It's called Nortriptyline. Well, a lot of people on Nortriptyline, you probably heard about that a lot. Okay, so you may have family. Well, depression, this disease, it's been around. Probably a lot of family members have suffered from this. Okay, now my mother used to suffer from depression. Okay, this is something that you don't want to hear. You don't want to know that you have friends or family. It's not that you don't want to know. It's like you need to understand those things. What is this about? And when they are on medication, you need to know why would that medication help them. And if they are not taking them, what would help them? If they are taking them with any side effect at all. Okay, this is important because today we're gonna discuss depression. Okay, so what is depression? Depression, I always ask my patient, they fill in the form and they take depression. That's because stress. And I say, what stress you? What make you depressed? And it can be, family thing. It can be kids, can be husband, can be mom and dad, can be works related, can be when they're little, they were kids and they get sexual abuse. Sexual abuse is a big thing. Okay, I meet a lot of patients, female patients, they are depression, they suffer from depression, and big time of them is from sexual abuse. So you really want to understand why are they on this and why they suffer from depression, and you want to help them. Okay, and how could you help them? Okay, being supportive is the biggest help that you can give your family when they suffer from depression. I want to share with you how my mom get better from depression. Okay, my mom, that was when I was uni. And my mom suffered from depression, and it was hard. I was in Shanghai and studying Chinese medicine and Western medicine and acupuncture. Way back then, I got a call uh, from my sister one day, and my sister told me that my mom was trying to kill herself. I was shocked because I knew that may happen. That's going to happen. Why did I say that? Because when my mom told me she was on the drugs of antidepressant, and I called my sister, I said, Mom shouldn't on that medication because that medication will make people went crazy. It may make them think about suicide. And they did in my mother's case. And how I helped my mother to recover. And I want to share with you tonight. Now, if you're watching this video, you need to check out this disclaimer, okay? On the YouTube is in the description area. On the Facebook is on the top, okay? You need to check the disclaimer. I'm here to share my experience. I'm here to be supportive. And if you suffer from depression, you're on antidepressant, or your family on antidepressant, you may want to share this video or tag their name onto this post so that let them know how they could help themselves, or one of your family or whoever, your friends, family, they are antidepressant, you want to tag them in this video, okay? Because I want to share the experience of mine, okay? First, we're gonna focus on one thing is we're gonna understand what before taking this medication, antidepressant, we not this medication. What do you have to consider about now? If you have recently had a heart attack, okay, you should not use this medication, okay. Uh, if you are uh, allergic to seizures medications, then you shouldn't take this. Or if you're allergic to a similar antidepressants, okay, uh, you shouldn't take this one as well, okay. Not to not triplines. It can be it may not be safe for you, okay. Um, to make sure nortriptyline is safe for you, you have to tell your doctor if you have heart disease or a history of heart attack or stroke or seizures, bipolar disorder, right? Liver disease, diabetes, a thyroid disorder, okay, uh, or problem with urination, like hard to pass, difficult to pass, or glaucoma, okay, with eye disease, glaucoma. Um, the side effects, we're going to look at the side effects, okay. Let me go to the side effect page. Now, you have to report to your doctor because most of people suffer from depression and they are on medication. And thing is, your doctor wouldn't tell you this side effect. So I'm here to tell you that the side effect. If you figure out that your family suffer on medication of antidepressant, and you realize that they have something changed, okay, I'm gonna name it all to you. Then you need to mention to your family that take them to see the doctor and report it to your doctor, to your GP. Okay, this is important. So report any new or worsening symptoms to your doctor, such as mood or behavior change, anxiety, panic attack, trouble sleeping. You know, if you feel impulsive, you know, irritable, aggressive, restless, hyperactive, or mentally or physically, you just can't stop. More depressed, you're taking the medication to help you relax, but you feel more depressed or have thoughts about suicide or hurting yourself. Okay, and this is very bad. In America, those people, they in the school and kids get the gun and kill themselves and kill other people. You check on news and see those people, those students, do they have were they on antidepressant or not? Most of them on antidepressant. As a small thing, and when they on antidepressant, it become big thing for them. They have different thoughts, and so they get gun and they kill people. This is all on new. If you if you just people focus on how many people they kill, how awful is that? But people didn't realize that those kids actually were on antidepressant, on the drugs for many years, and then it didn't help, and they start to kill people. You see, and it's suicide. So you need to call your doctor and report to your doctor, your GP, if you have aversion issue, eye pain or swelling, or seeing horrors around light. Okay, a blurry version. So your eyes getting not good. So this is one of the side effects of nortriptyline. Restless muscle movement in your eyes and tongue or jaw or your neck. All right. So you feel uncomfortable in your neck. This is one of the side effects of that. Light headaches feeling like you might pass out. So you get light headaches. It's not very big pain, but it's just light headaches. Seizures, new or worsening chest pain, pounding heartbeat, stirring in your chest. Okay, numbness, a sudden numbness. It can be in your hand, face, or legs, or any part of your body. Or weakness. You feel weak. Okay. Uh, like you get balance problem when you walk. You feel imbalanced. And speech problem. Okay. So when we talk about this, I have patients have like uh, stroke conditions. They're not a stroke, and they were on antidepressant, and they start to have speech issues, and that is a part of the side effect of medication, and people just didn't realize that. And I will tell you, most doctors didn't care about this, and they didn't even thought about this could cause from the side effects, although they give you the medication. You know, I have patient. My manager just told me that uh, once she went in to get some prescription, and she asked the doctor, "Were there any side effects for this drug?" And the doctor just said no. And then when she went to the chemist, and she asked the people over there, and they say no. The worker over there, the counter, and they say no. And then uh, she met a pharmacist and asked it again, and they said yes, there are a lot of side effects of this drugs, and he or she print a list of side effects to my pet manager. And of course, she decided not to take it because there are a lot of side effects of the drugs. You just didn't know, and they never tell you that. So, yes, we always tell our patient do not Google your symptoms. But when it comes to drugs, I actually encourage my patient to Google it. Google all the side effects of the drugs. You know, you may find something. You may take a drug for many years, and you start to develop a new problem. Everything's fine, and then you suddenly get something. Then you keep searching, and you go to all the specialists and GP, and you find, where do I get this new symptom from, new condition from? And everyone check and check and check. No one could tell you what's going on. Then you need to sit down and go over all your drugs. You may start 20 years ago, 15 years ago, or even 30 years ago. You need to take it all out and check all the side effects. Well, you don't have the side effect for 10 years, 20 years, or when you start taking it, it doesn't mean you won't get the side effect right now. Why did I say that? Remember last week we talked about one of my patients, she told me that her mother-in-law was in the hospital because her internal organs was bleeding because of medication. One of the bigger medication that cause internal organs bleeding is aspirin. Then a mother-in-law take 33 pills every day for 30 years. Hey, she was taking those pills. She didn't get internal bleeding when she was taking for 10 years, 15 years, 20 years, 25 years, but it happened when she was taking those medication for 30 years. So the side effect, the toxin build up in your body. You see what I mean? You may not have the side effect in the beginning or 10 years or 20 years, but this side effect may come afterward, after 30 years, 40 years. So when you have a new condition and you keep searching and searching, you see a lot of specialists and your GP, you've done a lot of tests, and no one can tell you what's going on, then you have to question all your medication. Go and find out all the medication side effects. This is truth. I need to share with you this because I realize my patient when I help them to get acupuncture and Chinese medicine done on them, and they gradually decrease the medication, and they find it, and we find that the symptoms, what they suffer from, and they keep reducing even faster. Then they didn't seem to not coming back, and then when they finish all the medication, stop all the medication, their body heal even faster. So this is why I am here to telling you this information. All right. So everyone have the right to question the medication, to question your GP, even me. All right. Fever, sore throat, easy bruising. Wow, there's a lot of people have it. You bruise easily. Okay, so like this is like what? Like you taking warfarin and or aspirin, right? Unusual bleeding. Look, nortriptyline will cause you bleeding. This is a big thing. Painful or difficult urination. Now again, if you're taking this medication, if you go for pee, you have pain, and you may think that you have an infection, and you go and get the test done, and you don't have infection in your urine, then it may be because of the medication. Your doctor may say, well, you've been on this medication for 10 years, it never happened before, then it shouldn't be that medication. This is not right. You still need to question about this medication. Yep, a very common nortriptyline side effects may include, wow, this is big. A lot of people have this. You know, I've seen a lot of people have it, and I actually recently have a patient who have loss of appetite and bloating in the tummy, you know, nausea and vomiting. That's actually a very common side effect of nortriptyline. And you may think that, wow, I got some bug, I ate something wrong. You're not. It can be, it may be from the drugs. Well, antidepressant, it should help you in your depression condition. Well, a lot of people depressed and as well as they suffer from anxious. But you know, one of the common side effects is they make you anxious in this drug and make you not sleeping. Wow. They make you insomnia. When you have suffer from insomnia, what you gonna do? In daytime, you're gonna feel very tired because you can't sleep at night. Okay, dry mouth, unusual test in your mouth. Most of them will say, "Well, I have met a metallica test in the mouth." I never take this kind of test. I don't know. Some of them is bitter test. So dry mouths. Constipation. What is this? So we were talking about nausea, vomiting. This is all spleen and stomach function issues. Okay, spleen and stomach. And now constipation. intestine, digestion problem, breast swelling in man or woman. Well, you get swelling under breasts. Well, decrease in sex drive. This is not a big thing. Decrease in sex drive. And in men, you get impotence. It's you can't get erection, right? Difficulty having an orgasm. There's another one. Now, there is not a complete list of side effects that I just list for you. I just tell you, or this all information is for www.drunks.com, not Triptyline website. Okay, so this is not a complete list of side effects, and other may happening. So it may happen in other conditions as well. So you need to consult with your doctor and to a medical and get advice about the side effects. Okay, you need to do your own research, to be honest, because what happened is I find if a patient go back to their GP and they talk about the side effect, if the doctor are very believe in medication, and it will tell you that this is not the side effect. You need to find someone that's open mind and they have experience in this. Okay, now I'm gonna share the story of my mom. So my mom took a business when I was in uni. Then the business wasn't going well. So it's a dairy shop. Then what happened is my mom was so stressed and depressed because of these things. And then she still need to run the business, but the business didn't get her any money, losing money, because the people that sold her the shop actually give her a fault expectation, a fault hopes. Okay, that was not good. So I knew that, but I couldn't do anything because I was in university. I was studying, and I knew that mom couldn't sleep and got wheezing like asthma, and couldn't sleep, and very, very, very difficult life way back in with my uni times. Then mom called and told me all about this, and my sister called me, told me all about this. And one day, she couldn't sleep, and she had menopause as well. So sweating and very hard, all this thing happened, in pain, and so one of her best friend who suffered from depression as well, and she went to a doctor, a specialist, and get antidepressant, and she found that actually helped her, relax her a lot. She'll be able to go to sleep better. Then she introduced my mom to see a specialist, and my mom went there and got home some antidepressant. And my sister told me that mom started the medication. I didn't know what to say. I know the side effect of it because I studied that. We studied Western medicine in the uni. Then I told my sister, mom shouldn't take this medication because I've seen a lot of new cases, and my master told me that they will make the patient have suicide thought. But how could my sister do anything? She couldn't do anything. She just told me, well, her friends said it's working for her, Well, most of us just listen to friends, and keep your hope up and listen to a specialist, Well, that's okay. Within a month, my sister called again and cried on the phone and told me that mom tried to kill herself. I was lucky that my brother's sister came home early. His girlfriend came home early and stop my mom. Look, mom try to kill herself, hang herself in Malaysia. We have a fan in the uh, living room, so she was trying to put the rope and hang herself. You see, all this thing, it was so sad. You never thought about your family, your mom, my mom would try to hang herself. And when I heard about that in the phone, I was crying. I didn't know how to help my mom. I was so sad. Then I actually told my sister, I said, I was lucky that I mentioned that side effect to my sister way back a month ago. So I told my sister, you see, what I said was true. It may not happen for her friend, my mom's friend, take antidepressant for years. But now it's happening for my mom. And I don't want that to happen again. So they say you must tell mom to stop the medication. And I will prescribe Chinese herbs to my mom. So every 3 days I actually call my mom and ask her conditions and prescribe Chinese herbs. I wasn't even graduate yet, but I have a very good master. And I asked my master how about my mom's case. How do I prescribe all Chinese herbs? And I did it all myself and prescribed Chinese medicine for my mom. That was my very first, very first experience with depression. That was my mom. So my mom took Chinese herbs. They went and bought it in coconut and drink it every day. Okay. So this is one of the key, using Chinese herbs. And the other key is the support of family, the love from family. So I called my sister and told my sister that this is something that we need to do together to get my mom all better. We need to support her. We need to talk to her every day and keep her positive. We don't blame her. We need to be understand her situations because they need care. One of the biggest thing is so powerful is people care about them. They feel the love from the people. They want to know that still people care about them. They want to feel warm feeling. And this is so important. This is how they get better. Okay. So if your family or your friends or you suffer from that, you need to talk about this rather than just taking medication. So acupuncture is phenomenal and Chinese medicine is phenomenal for depression. But when I say acupuncture and Chinese medicine are phenomenal for depression, I'm not telling you that just using acupuncture and Chinese medicine is good enough. This is not. You need family help, family support as well. Okay, this is my experience. And then in our clinic, we support them. We suggest them to do an emotional daily practice, which I showed you before is Ho'oponopono method. We do it for all our patients. We introduce to our patient to to practice it. Now, if you believe in God, you're Christian, you Buddhism or Taoism or Muslim, whatever, you need to go back to the book, your religion, and read about all this thing. And if you believe in it, you need to pray every day. And this is not a way to go. This is very powerful. Okay. Or if you do yoga, or if you do any exercise and you feel better, you feel relaxed, it doesn't make you think the negative things, and you should do it. or meditation. All these things help. So my point is, acupuncture and Chinese medicine are phenomenal for this depression treatment. And we actually help our patient to reduce medication, eventually stop the medication, because our belief is no one needs medication. Those medications are just a replacement. We are not trying to replace anything in your body. We are trying to restore your organs function. And we believe that once your organs function restoring, then you will gain the ability of self-heal. Okay, so self-heal ability is the biggest thing, is the number one thing that will heal you. Okay, and acupuncture and Chinese medicine will just help your organs function back to normal, back to how it need to be. And when it comes to emotional problem, depression, anxiety, family support is important, but not everyone gets family support. That is why we want to introduce Ho'oponopono method. Okay, but if you have family support, you have Ho'oponopono method, or you have your church people to help you, then you are winning. You have bigger chance to fight and to win and depression. I don't know whether it makes sense to you or not, but when my mom was getting better, that was because me and my sister keep supporting my mom. We just talk, and I give her Chinese herbs, and she felt the love, from her son and her daughter, because we support her. We told her what to do. We told her, it's okay. We're here. We're here to support you. Still have us. We're supporting you. And when I was in uni, we don't have internet at home. We just call, and it was expensive when we called my mom. I spent a lot of money in call, but that was worth it, because without talking, without communication, without caring, all this call, my mom wouldn't get better. So that was important for my mom. So family support is a big thing, as a must, but not everyone will give family support. That's why we want a Ho'oponopono method. So I believe everyone can get better from depression. Okay, if any of your family or yourself or your friends family, they suffer from depression and they want to help, we are here to help. Of course, we need your GP to support as well. So we will talk to you, let you understand how to go back to talk to your GP to get the support you. Okay, but not every GP are open mind. But it's all about whether you believe it or not. You want to give it a try out, whether you be open mind or not. Okay, if you're an open mind person, then you're welcome to see us. We have 15 minutes free pre-assessment. That's free up to 15 minutes. Call us on 078467956. So 078467956 and book a free pre-assessment to one of our practitioners. And we're so happy to talk to you and let you know, provide you some information to let you know how we can help you and how you can get better from depression. All right, that's it for tonight, and happy to share all my knowledge, and you stay awesome, and I love you all. I'll see you tomorrow. See you. Bye bye.